I'd now like to invite Dr. Mike Downham, a retired children's doctor, to speak.
Oh, well, first of all, thank you, Jeremy, for making it so clear what the future holds for us if we just give up and accept the future we're being offered. It's nearly a year since the Zero COVID Scotland campaign was launched, and with the aim of stopping the epidemic. Now that 10,149 people have died, 100,000 people are living with long COVID, and the NHS has broken down, it's time to face up to the fact that the campaign has not succeeded in deflecting the Scottish Government from its COVID policies, policies which have not halted the epidemic and which have no chance of doing so. I'll start by recapping the strategies we've tried. First, in the context of the Scottish Parliament elections, we worked hard to persuade electoral candidates to adopt the Zero COVID method, explaining to them exactly how that method could be applied in Scotland, and drawing on the experience of countries which had applied it successfully. A good number of candidates across all the main parties undertook to proactively argue for this change of approach should they be elected. But once they'd become members of the Scottish Parliament, these promises melted away. We learnt the hard way that the governments of most wealthy countries, including Scotland, are locked into a global system where profit trumps health. Knocking politely on Parliament or town hall doors, asking politicians to do things few of them can even contemplate doing, gets nowhere. Neither Johnson or Sturgeon will turn back now from their COVID policies. To do so would be a denial of what they've done and not done over the last 2 years. When this became clear, we switched to seeking out some of the people who had been most devastatingly impacted by the COVID epidemic: health workers, care workers, people suffering from long COVID, the parents of children suffering from long COVID, and others. Our idea was to give these people an opportunity to be heard and to amplify their voices by coming together. We had one successful public meeting where 11 people spoke movingly about their personal experiences of COVID. But we soon discovered that these people are so weighed down day to day with stress or illness or both that it's extremely difficult for them to find the time or energy to speak out or to organise. We've added our voice to those fighting for vaccine justice, undoubtedly a laudable cause, but at a time when international disagreements and tensions are at an all-time low. Is it a realistic one? Or maybe I should say disagreements and tensions are at an all-time high. Is it a realistic one? Most recently, we've launched a petition calling for vaccination and classroom ventilation for all children of school age. Whatever the intransigence of our government, we remain committed to not letting it off the hook. Throughout the year, we've built a large Twitter following, and we've written articles for websites, some of them published in the mainline press. So the question we're asking at this point, and asking you today, is what can we do next? The context of this question has never been more challenging. The whole of the UK, along with the rest of the world, has been thrown into chaos by the Omicron variant, with China the one outstanding exception. Other disrupting variants are likely to emerge in the context of a world which, despite low vaccination rates in many poor countries, has largely given up trying to control the spread of the virus. As the desperate march continues in search of profit by destroying forest habitats for intensive farming, we face the probability of further pandemics with new, possibly worse infectious agents. And, of course, we face escalating climate change. The importance of what we do in Scotland at this point in relation to the COVID epidemic can't be overemphasised. Scotland may be a small country, but every country has a responsibility to try to find a way to stop its epidemic. Any country which makes progress towards controlling its epidemic could be a start towards controlling the pandemic globally. It could also be a start to slowing down global heating. The causes of the pandemic and of global heating are the same, and sustainable solutions will be the same. Passing on the blame for these crises to Johnson, as Sturgeon continues to do, offering her electorate a hollow promise of independence, ducks responsibility and delays vital action. Johnson's latest move this week, ending all restrictions, even masks and isolation, in a desperate attempt to appease his backbenchers, shows just how far politicians are prepared to go, risking the lives of millions as pawns in his game to stay in power. And Sturgeon is only a whisker behind, running scared from the right-wing press campaign to label her as unnecessarily cautious. The question of what we can do in the face of all this needs discussion in every community, every hospital, every care home, every school, and every workplace. I'll offer 3 contributions to this discussion, the first about vaccines, the second about health services, and the third about local action. In November 2020, I joined a WHO webinar the day after Pfizer announced that they had developed a COVID vaccine which was both safe and effective. By the end of the webinar, it had become clear that Pfizer had jumped the gun in the interest of winning the race with other companies. They hadn't completed their trials of efficacy, and there was very little information at that point about safety. Furthermore, there were the issues of supply, equitable distribution, and rollout. The final speaker at the webinar likened Pfizer's process to reaching base camp in an assault on Everest. The writing was on the wall. Vaccines would be clutched at prematurely by ruling elites because of their potential huge profitability, and by their electorates who had been stunned by the impact of the first epidemic wave. It was inevitable that vaccines would become an excuse for relaxing other less profitable and less disruptive public health measures so that economic recovery could begin. Since then, this championing of vaccines has escalated, resulting inevitably in more and more infectious variants, grossly inequitable distribution, the need to include younger and younger people in vaccination, and the need for boosters. We've recently seen an alarming increase in hospitalizations of children with COVID. And the evidence that long COVID has a physical basis, regardless of the severity of the initial infection or age or vaccination status, has been further strengthened by new evidence that the virus is present in a wide range of organs in people with persistent symptoms. Above all is the fact which seems so simple, but which has become submerged in Tory blue wash, that if we allow the virus to spread and simply, in Johnson's words, ride out the Omicron wave, new variants will emerge more frequently. For all these reasons, it's become abundantly clear that exclusive reliance on vaccines is unsustainable. This has become the key problem which any effort to stop the epidemic has to face. Having identified this as the key problem, we need to reclaim, as Jeremy has said, traditional public health measures without which no epidemic has ever been stopped, putting these centre stage and not allowing them to be relegated to mere mitigations. The taxi driver who collected us recently from Glasgow Airport made the point well and simply. If the Scottish Government had made wearing a mask compulsory right at the start, he said, it would have made all the difference. We were returning from visiting my son and his family in Prince Edward Island, one of Canada's 11 provinces. There have been no COVID deaths in the province since the start of the pandemic. The single most important reason for this is that the provincial government handed over total responsibility for COVID to the Chief Medical Officer. Dr. Heather Morrison, mother of 4, was quick from the start of the pandemic to publicise clear information about the virus, emphasising the importance of social distancing and wearing masks. She set up an efficient test and trace system, blocked all travel unless essential for health reasons, and guarded against imported cases. There are a number of lessons we can learn from that example, but the one I suggest we should focus on is to demand that Scotland's health services, hollowed out over many years by neoliberal ideology, must be rebuilt and reformed so that they are competent to be given total control of epidemics without political interference. There's another reason we need to rebuild our health services. We're now in a position where the NHS is so far behind with the diagnosis, investigation and treatment of life-threatening conditions that more people are dying unnecessarily from these conditions than from COVID. Lastly, I suggest that while the political pressure builds on the Scottish Government to restore and expand Scotland's health services, we need to take immediate steps ourselves at community and workplace levels to fill the service gap in whatever diverse ways we can. At the very least, we can take conversational opportunities to stand up for a different COVID future from the one we're being offered by our leaders. Sticking to the simple public health measures, meet outside, wear masks inside, isolate if you have signs of infection. It might also mean working with others to provide outdoor spaces where people can safely meet to discuss health and care issues with each other, calling on expert advice when they need it. Or it might mean identifying specific people in communities or large workplaces prepared to give advice, finding ways to recompense them for their time, and providing them with training as necessary, along the lines of the community health workers who have become established bulwarks of primary health care in many poor countries. To those who say this is too ambitious, I would say this is an exceptional crisis needing exceptional solutions. The doctors won't like these initiatives one bit, but remember that in 1948, many of the doctors had to be dragged kicking and screaming into the NHS. In the face of the crescendo of "we've just got to live with it," we should be clear what accepting that will result. In my version of what Jeremy has already said, it will result in a significant number of deaths, even if less initially than in 2020 and 21, a big additional strain on hospital services, a lot of long-term illness, including in children, constant strain on school services, significant economic disruption, and the long-term prospects of variants emerging for which vaccines will need to be adjusted, with adjustments inevitably lagging behind changes in the virus, so that in those lag periods, deaths could be as high again as they were in 2020 and 21. A recent article from the United States gives robust evidence that China's report of only 2 COVID deaths in 2021 is true. In the US, 476,863 people died of COVID in that same year. As the authors say, what the dramatic difference in public health outcomes between China and the United States demonstrates is that the massive death toll of the disease here in the United States is not an inevitable natural disaster, but the result of a system and a set of policy choices made to keep the capitalist profits flowing, no matter how many lives it costs. And we could add that the poorer people are, the less their lives matter. Working within such a system can be daunting, but we have no choice. As John Clark, a poverty activist in Ontario, put it recently, the harsh truth is that we live under a system of global capitalism that is prepared to deny basic health protections to the poorest. But we're not yet living in a police state. There are still spaces within that system, especially at a local level, and that's where I believe we can make all the difference.